Are telerotations useful? Do they help you match? How do they compare to the on-site rotations? And more importantly, what do programs and the program directors look for in your ERAS CV and during the interview as they discuss your telerotation experience? So all this we'll discuss today, and we'll also discuss what kind of applicants, what profiles should actually consider telerotations. Welcome to our channel where we discuss all match-related issues weekly. So if you're first time here, consider subscribing to us on YouTube and follow us on Instagram. So today's two questions come from our Facebook group. First question, I'm confused about telerotations because I have no USCE. Should I go for it? And I've heard it is just years, and with attendings, you are discussing some cases. Second question, is the LOR from telerotation counted as USCE? So now we have enough data and information from the 2020 season to discuss all aspects of telerotations. Of course, we all know the one impact that COVID-19 created was how it impacted the rotations that AMGs, IMGs were having, electives, externships, and how all that got hit in 2020. From an IMG perspective, many of our IMG students, because of travel issues and visa issues, could not do on-site rotations in 2020 and had to resort to the telerotations. So as all of this was transforming the telerotations, many of the affiliated clinics and hospital adapted to the virtual training and interaction with patients over video. So at USMLE Sarthi this year in 2020, we had more than 150 students do telerotation. Then we also discussed with the attendings and physicians at these programs, preceptors, about the impact of the telerotations, about the learnings that these students were getting, and how it was impacting the interviews. We then analyzed the interview data, interview experience of our students who had done telerotations to see how these rotations were being considered by the programs. So using this set of data, we'll now answer some of the questions that we have received. But before we start, what are these programs actually looking for? What are the program directors looking for when they see telerotation on your CV? Well, whether it's telerotation or on-site rotation, they want to make sure that you have a good understanding of the US healthcare system, that you know what evidence-based medicine is in theory, and you can implement those concepts in practice, whether it is discussions with the patient, whether it is case presentations and such. And finally, they want to make sure that you do understand the patient-centric approach that they follow in the US healthcare. And what are the programs looking for in telerotations during the interview? So our students who have done telerotations have not reported any issues around telerotations. Many of them actually have received pre-match. In fact, one of our students who had only telerotations received and accepted a pre-match as well. This student had not done any on-site rotations, and it was only 3 or 4 telerotations on the CV. So in the interviews, the program directors and the committee is mostly concerned about the following when it comes to telerotations. How was the telerotation structure? How many hours per week did you spend in telerotations? Was there any patient interaction? Did you do any history? Did you have access to EMR? How did you present cases? How did you discuss the cases? And then they would ask about the examples for case presentations and discussions. What did you learn about evidence-based medicine as part of the telerotations? So these were some of the questions that have been frequently asked of applicants who have done telerotations. Now, once you understand what programs are looking for from these telerotations as they evaluate your ERAS CV or during the interviews, it is easier for you to assess whether you should go for some of these telerotations. But before we do that, let's understand broadly how many types of telerotations are there, because there are variations. So our students have experienced mostly 2 types of telerotations, and there can be some minor variations. So the first type of telerotation is where you will have access to patient information, you will interact with the patients over a video, discuss their history, and discuss the case with the preceptor or the team. This is very similar to the on-site rotations which you may be used to and you actually get to see about 10 to 12 patients a day. You will interact with the patients, you will be responsible for patient management, you may have access to the EMR system. So a very rigorous kind of training. Many of our partner physicians offer this model. So if you are interested, I'll have the link below in the description as well. The second most common telerotation is didactic based. Now, in these cases, you may not have direct patient interaction, but you will have a lot of critical thinking. You will do a lot of case presentations. You will look at protocols, discuss those cases with the attending physicians. Now, some of our partner physicians also include sim lab experience in these kind of simulation labs work where you may be remote and attendings and some of the medical students may actually be on site, and then you interact with them. They will use high fidelity mannequins, task trainers, standardized patients. So I'll have a link to some of these rotations and you can see how they use sim labs in such cases. Now, out of these models, which one will fit you well? Will it be the actual patient interaction model where you get to see 10 to 12 patients a day, or should it be the didactic based where there is a lot of case presentation, critical thinking, and so on? The answer is it depends. Broadly, if you have not done any US electives, you're a recent graduate, you haven't had any patient interaction, may not have done CS or equivalent exam, it will be a good idea to go for the first model where you actually do patient interaction over Zoom. So that would be a good fit for you. But of course, remember that in such cases, you ideally will have to work US times because they see patients during the US time, whether it's East Coast or some of the other time zones. But many of our students with extensive home country experiences, extensive residency experiences in internal medicine, OBGYN, actually found the second model, the didactic-based model, to be much more powerful. They already had those patient experiences. They wanted to understand how the evidence-based system works here, how the case presentations work here. So they went in for the didactics-based model. And of course, because they were working full-time, the timing issue is another issue they needed to consider. But there are other considerations that can help you decide which one to follow, and we'll come to that very shortly. Now let's come to some pros and cons of telerotation. First, understand that telerotations may actually not go away even in 2021, because of the issues with COVID, some of the travel restrictions, some of the safety restrictions that hospitals have put in. It may just be not easy for you to get on-site rotations. So that's some consideration that you have to make. The first obvious advantage of a telerotation is the cost of living. Of course, you don't have to travel there, you don't have to spend on housing and living in that city and so on. So you end up saving some money. The biggest advantage, though, what we found, our students found, was the flexibility. So many of our students, like I mentioned, were in their home countries working full-time. Some of the other students we had were in different locations like California or Seattle, and they welcomed tele with open arms because they were also working or researching. So they found this flexibility very welcoming, and they could understand the US healthcare system, they could interact with the patients while still continuing at some level their own work. And of course, remember that the telerotations typically will not last 8 hours a day. Most cases, it is 3 to 4 hours a day, maybe 5 days a week. So if you are preparing for, say, step 3, some other exams, you have other commitments, you will be able to fit in tele more easily than opposed to an on-site. And of course, there were cases when our students managed to do more than one telerotation at the same time because they were scrambling to get those letters of recommendation. So if you are in a situation that you need letter of recommendation, but you have other work commitments, that will also come in handy. Finally, the telerotations also give you an opportunity to dive deeper into cases, more didactics, like I said, more critical thinking, and build a stronger foundation. So some of these may be difficult to find to that degree in an on-site rotation where there is always a rush. So what are the disadvantages? Of course, the most obvious disadvantage is that you're not on-site. So networking is always been essential. You're not in the hospital. There are elements of teamwork that you will not be able to do in tele. You'll not probably be able to network with other physicians, other attendings. So that's something obviously to consider as you're planning your USMLE journey. So this will be a disadvantage in tele. And of course, if you are looking for a rigorous 10 to 12 hours a day learning experience, that kind of a schedule, that's not going to happen in tele. Like I said, most tele rotations will limit to 3 to 4 hours a day, maximum 5 hours a day. But what about the quality of LORs? From what we have seen and discussed with the attendings and feedback from the interviews, the quality actually does not vary. If you have done good work in any of these tele-rotations, the attending will give you very strong LOR, and it'll be almost similar to what you would get as an on-site rotation. But before you decide if tele-rotation is fit for you, if you have this opportunity, you should evaluate it completely. So what are the type of questions you should be asking? Of course, first important question is affiliation. What kind of affiliation does that clinic or the physician have? Is it affiliated with a program? If the clinic is affiliated with a residency program, absolutely golden, because you may be able to get that LOR on the hospital letterhead. The physician may be able to recommend you, and that recommendation carries a lot of weight. The second most important thing you need to ask is the type of experience, the type of rotation. Is it only didactic based, or you will actually get to interact with patients over Zoom or things like that? So the two models that we discussed earlier, which model is the physician going to follow? Like I said, nothing is wrong with either of the two models, but you should know which one you're going to get into. The third, of course, is the access to EMR, next hours per week that you will be expected to spend, opportunity to present cases, discuss those cases with those peers. So all those things you have to really understand before you commit to a tele-rotation. And I didn't mention the fee, but fee is important, whether it's tele or on-site. So that helps you evaluate all the options. So now for the other important questions, should you consider tele-rotations, or what kind of profiles we have seen that benefit from tele-rotation? The first profile is the recent graduate. So if you're a recent graduate who could not do on-site rotations, on-site electives due to COVID or travel issues, you may find tele-rotations to be very useful. Many of our students, recent graduates who could not do on-site rotations, actually got a lot of interviews based on tele-rotations itself. And like I mentioned, many of them have pre-match offers as well. And the reason the recent graduates have an advantage or they can leverage these tele-rotations is very simple. They are in their internships or they have just finished their internship. So they are clinically very current. And the tele-rotations help them understand the US healthcare system and some of the other advantages that I mentioned. So they are able to leverage it more powerfully. The other category of applicants who benefited or continue to benefit from tele-rotation may actually surprise you. These are individuals or applicants who have extensive home country experience. I mean, we have had practicing OBGYNs, gynecologists out of India, 20 years of experience. People with home country experience in internal medicine, in neurology, neurosurgeons who have been able to do tele-rotations because they could not travel for on-site rotations. But these are very, very experienced applicants who have a niche in their home country as well. So they already bring those clinical skills, the interaction with the patient, those kind of skills, and they are only looking to get and understand the US healthcare system. So you can see the two kind of applicants that benefit the most from these tele-rotations. Now, who does not benefit from tele-rotation? So if you're an applicant who has had long gaps for whatever reason, if you're not current with your clinical experience, the clinical skills, if you took a break more than 6 months, 1 year from the clinical side of things, you may not find tele-rotations to be as impactful, as beneficial. In that case, you should first look for some on-site rotations. Some of the hybrid approach may also work for you. So you could do a few months of tele-rotations, but you definitely will need on-site rotations if you've had long breaks. If you've had some other red flags like very low scores or attempts, you definitely would want to supplement your experience with on-site rotations. A couple of months of tele may be good, but the programs in your case will definitely want to see on-site experiences, those LORs from on-site rotations. This is, of course, if you are in the US. Now, if you are in the home country, you still have breaks, there is no substitute for full-time work. Get to work full-time, busy facility, hopefully inpatient experience as well, and then you can supplement some of that with the telerotations. So that's all we had this week. Thank you for watching, and do share it with others who may benefit from this video. And don't forget to subscribe to our channel as we bring you weekly updates on the USMLE match. Thank you and good luck for your match journey.